Hi everyone, I'm Dr. Priscilla and I'm an optometrist. So people often ask me what the numbers of their glasses prescription mean. So in this video, we'll break it down bit by bit so you know exactly whether you're short-sighted or long-sighted or how bad your eyesight is. Now let's get started. So your eyes work like a camera where light enters the eyes or the camera lens and it has to focus the light to the back of the eyes, what we call the retina or the sensor of the camera. When light doesn't focus properly on the retina, it ends up focused either in front or behind the retina, and that's when you see things out of focus. When you have perfect vision, your eyes naturally focus light properly on the retina. When things are out of focus, we require glasses to help redirect the light to focus at the retina to achieve clear vision. A glasses prescription tells us exactly what power lens is required to do that. And there are three main conditions that causes this poorer focusing of light: short-sightedness, long-sightedness, and astigmatism. So a typical glasses prescription looks something like this. Firstly, we have the prescription for your OD, oculus dextrus, and OS, oculus sinister, which is the Latin abbreviation for right eye and left eye. Next to it is the first number, the sphere, which tells us the strength of your prescription. A positive number means you're long-sighted or hyperopic, and a negative number means you're short-sighted or myopic. And the larger the number that goes away from zero, the stronger the prescription. And this is measured in diopters, which is the measurement of refractive power of the lens that is required to get your best vision. And it goes by 0.25 diopter steps. So from 0, we then have 0.25, 0.5, 0.75, 1.0, and so on. You may also see PL written in prescriptions, which stands for plano, which means 0. So you're neither long-sighted or short-sighted. The second part of your prescription is the cyl or cylinder. This determines the strength of astigmatism you may have, which is annotated with a minus in front. You might find some scripts done by ophthalmologists with a plus in front, which the overall script still tells us the same thing, and we can easily convert it to the minus format. Astigmatism is when your eye shape is a bit irregular. So instead of a spherical eyeball shape, your eye shape may be more like a football or rugby ball. This causes light to be focused on different points at the back of your retina, causing the perception of blur or distortion. You may notice the effects of this especially looking at lights at night, where lights can look streaky or have like a starburst appearance. And astigmatism can be corrected with glasses, and not everyone has it, so that spot on your prescription may be left blank. Astigmatism is also measured in diopters in 0.25 steps. The axis is the second component of your astigmatism prescription, and it tells us what direction the football shape is pointing at, so we know where the astigmatism prescription should go. These three aspects of your prescription gives us your distance prescription, which you may use for watching TV or driving. The next part, the AD, is short for addition. It is the additional correction you may require for near work or close-up activities. And this can be due to presbyopia, which is when we lose the focusing ability of our lens as we age, and is commonly experienced after 40 years old. A close-up prescription may also be required for kids or young adults if they have a binocular vision issue, which means their eyes are not focusing efficiently or effectively up close. And this number is added onto your distance prescription. And this add part of your script will allow you to get bifocals, reading glasses, or multifocal glasses. There's also an area in the prescription that isn't included that often. This is for prism. Prism is short for prism diopters. It is used for people who have strabismus, which is a turned eye, or for people who have a neurological condition or head trauma and they'll experience diplopia, which is double vision. Double vision, as the name suggests, is when you see two images when there should actually be one. It may also be prescribed in people who have binocular vision issues, which I mentioned earlier is when your eyes aren't focusing efficiently or effectively up close. And the prism helps to bend and redirect the image you see to the appropriate spot at the retina, the back of the eyes, to achieve single and comfortable vision. The number will precede a direction for the prism, either prism base down, up, left, or right. PD means pupillary distance, and that is the measurement of the distance between the center of your pupils, which is the black part of your eyes. It is required when making up your glasses to ensure the lenses are actually centered on the frame where your eyes are located. And this might not be included in your prescription, as it might be measured once you have actually selected your frames. And your glasses prescription is not the same as your contact lens prescription. And there are also a few other numbers that are required for contacts that doesn't apply to glasses. We need the lens manufacturer and brand name of the contact lenses you've been prescribed. If this hasn't been filled out, then contact lenses can't be dispensed, even if all the other specifications are there, as that specific lens is the only one that can be dispensed and cannot be interchangeable with other lenses. On the contact script, you'll see BC, which means base curve, which is the radius of the contact lens measured in millimeters. This tells us how steep or flat the curvature of the contact lens is. If the lens is too steep for your eyes, it will be too tight, and this prevents oxygen getting to the eyes and cause complications. And if the contact lens is too flat, it will be too loose and cause excessive movement and fluctuating vision on the eye. So we need it just right. So whether it's for your prescription contacts or non-prescription contact lenses. DIA stands for diameter, which tells us how wide the contact lens is in millimeters. We want the diameter of the contact lens to cover the cornea, the clear front surface of the eyes, and we also want it to extend past it by a few millimeters. If the diameter of the lens is too small for you, then it doesn't cover your cornea properly, which then the edge of the lens can cause rubbing and damage to the cornea. The eye doctor assesses the fitting of the specific brand of lenses on your eyes to ensure the base curve and diameter of the lens is suitable for your eyes before prescribing them to you. Glasses and contact lens prescriptions must have an expiry date in order to be dispensed. The expiration date may not be the same for both of them, and this will be determined by your eye doctor, taking into your eye health and eye history into account. And you should find the name and signature of your eye doctor on the prescription for it to be valid. Your eye doctor can give you a copy of your prescription if you want a record of it. So that's your prescription explained. So if you like this video and want to see more videos going through your common eye questions, please give this video a thumbs up and subscribe. Leave a comment down below if you know what your prescription is. Thanks for watching.